Are you considering getting dental implants but not sure if they're right for you? There are a bunch of reasons why dental implants might not be the best option for you, and I want to walk you through them so you're well informed. And hold on, this video has points I didn't find in any other video, so pay close attention. Hey there, I'm Dr. Ibrahim, a dentist, and I'm here to help you take care of your mouth. First off, let's clarify what dental implants are. Dental implants are titanium screws we place into the bone, and we can use them to replace a single tooth, multiple teeth, or even a full set of teeth. The procedure happens when you have good, healthy bone. We implant the screw into the bone, then close the gum over it. It takes about 3 to 4 months for the bone cells to grow onto the surface of the implant, a process we call osseointegration. The implant becomes a part of your bone once we achieve this level of integration. After that, we can start putting the dental prosthetics on top of it. The first thing I want to do is explain what makes a good candidate for dental implants. For dental implants to be successful, primarily, 2 essential things must be present. The patient must be in good health, including their mouth, and there must be enough good bone. There are a few main health concerns that raise red flags for implants. The first one is uncontrolled diabetes, the main reason being that elevated blood sugar generally affects wound healing, so the bone won't form properly around the implant and it's more prone to failure. The other concerns we have are medications that treat osteoporosis like Fosamax and Boniva, because these medications hinder the body's ability to heal wounds around the implant. Here I mention medications that treat osteoporosis and not osteoporosis patients themselves, as they can have dental implants normally if they are not taking these medications. Other health concerns pertain to cancer patients undergoing radiation therapy, especially in the area of the face, jaws, and neck. These individuals should never undergo dental implantation until a long period, ranging from 1 year to 2 years after the end and cessation of radiation exposure. And of course, other concerns if there is active cancer in the jaw and in the location where dental implant placement is intended, as this may lead to cancer spreading. The other factor is healthy bone. What I mean by that is we need to have enough bone because the implant needs to have bone completely encircling it from all sides, but the bone also needs to have sufficient thickness. If the edge is too thin, the implant might be at risk of failure and possibly even bone fracture. This doesn't mean it's impossible. We can always augment bone volume. We have several procedures for bone grafting and bone augmentation for dental implants, but each case varies in the amount of bone needed for implant success. So this is something left for discussion with your dentist after reviewing your 3D scans. These scans also show bone quality and density so we can determine if it's suitable for implant placement or not. Another advantage of 3D scans is that we can plan your surgery from start to finish by digitally pinpointing the exact location of the implant in advance, so we know exactly where we want to place it, ensuring the best chance of success. It also allows us to pre-plan the location and placement of the dental prosthetics that will be placed later on top of the implant. This planning is transferred from the computer to inside the mouth by printing it using a 3D printer. A common question we receive is, how old should I be to get dental implants or not get them? And it's a great question, and of course the answer depends, because honestly there's no maximum age as long as you're in good health and have good bone and we feel confident you'll heal. Age is just a number. Some patients have undergone implantation at the age of 90 and it turned out great. But as for the minimum age to get dental implants, when you're younger, that's a problem because we don't know where your bone will grow. Typically, we're uncomfortable with implanting patients under 18 years old because the jaw bones haven't fully finished growing yet, and this affects their growth later on and the site of the implant itself in the jaw later. Instead of implants, we can compensate for the missing tooth with a resin-bonded bridge, or a removable denture consisting of a single tooth or as many teeth as are missing. Another aspect that affects the success rate of implants is smoking and tobacco use. Smoking not only generates a lot of intense heat in the area, but also the actual act of smoking can pull blood clots and prevent the area from healing the way we want it to. The chemicals and carcinogens they put in cigarettes and tobacco can harm the mouth and prevent it from healing. For the implant to be successful, we want to create an ideal site where the body can make it successful. Now, if you're a smoker, we can deal with that. We can use nicotine patches. We can do things to help you quit smoking. In fact, many patients use getting an implant as a reason for them to quit smoking. They get the implant, then they quit smoking for 6 weeks, and that's great. Saves a lot of money, and they feel much better. It worked. There are also people who are not considered candidates for implants, and they are people who have very, very weak bone. Either you've lost teeth for a long time and large portions of the bone have been eroded, and as we said, there are cases of bone erosion and can be solved by bone grafting, but here we are talking about significant erosion that is very difficult to treat. This only the dentist specialized in dental implants can determine. The last category is people who have very poor oral hygiene. No one likes to talk about this, but if you're not brushing your teeth and taking care of them, I don't think you should invest in putting teeth back in. If you're not maintaining oral hygiene, just as decay can happen in teeth, plaque and tartar can build up and that can cause bone loss. So you need to be motivated to care for your oral and dental health. And this last category is people who are not motivated to care for the necessary cleanliness for implants. Sometimes people think that with implants they don't need to brush their teeth or use dental floss. And in fact, the opposite is true. Often with implants, more attention to cleanliness is required to ensure their success. Now, let's talk about the steps you'll do to figure out if you're a candidate for dental implants. Every patient is supposed to get a 3D scan, which allows us to see the full picture to analyze where we might place the implants, evaluate the health of adjacent teeth and the strength and quality of the bone, and see details we might not be able to see clearly and plan for. We'll also have a detailed discussion with you about your general health, and if you have any health issue, we should know before proceeding, as we said. We also discuss your goals because not every patient is the same. Just because you're missing a tooth doesn't mean you need an implant. There are many other options we'll discuss in other videos, and you can find one of this videos here. But sometimes implants may not be the right solution. Having this deep conversation with you to make sure what you want is what we can provide for you, so we're all on the same page. If you seem interested and have questions about whether implants are right for you or not, please leave a comment down this video. Thank you and keep smiling.